All right, let's dive in. Today we're tackling the world of certified nursing assistants.
CNAs?
Yes, CNAs. And specifically,
Training.
focusing on one key area, body mechanics.
Yeah.
You might think, body mechanics, isn't that kind of basic? But
It's more than it seems.
oh, absolutely. We've got the official training curriculum here from the California Community Colleges.
Oh, wow.
And it's really interesting to see how much emphasis they put on this.
Yeah.
This isn't just like a quick, and lift with your legs. This is really a core part of everything.
Everything a CNA does.
It really is the foundation of everything they do.
Before we get into the real practical how-to, let's break down some of the lingo. Because I was looking through this thing and I was like,
all right.
Fowler's position, Trendelenburg.
Log rolling. It's in a whole nother language.
Yeah, it's practically a secret society.
Right, but every profession's got its jargon.
Right.
But these terms are really important because they are.
Represent very specific techniques.
Yeah.
So, for instance, you've got a patient that needs help with blood pressure regulation.
Okay.
That's where Trendelenburg comes in.
Okay.
So you're actually tilting the patient so their head is lower than their feet.
Wait, so you're basically tipping them upside down?
Kind of.
Yeah, that seems so counterintuitive.
I know, it sounds strange, but you're actually using gravity to help improve blood flow to the brain.
Okay.
It's also really helpful if a patient, needs their airway cleared quickly.
Oh, interesting.
So, there's a real physiological reason behind it.
So it's not just like some random thing they made up. It's like...
Exactly.
No, this actually... This works.
Yeah.
That's cool. Okay.
Mm-hmm.
So we've got these special terms.
Right.
But what about the everyday movements? Are there ground rules for how to use your body properly as a CNA?
Absolutely. And it all comes back to protecting the CNA's back and ensuring smooth, controlled movements for the patient.
Right. So they're not jerking people around.
Exactly.
Okay.
So one of the most fundamental rules is maintaining a wide base of support.
Okay.
Think of it like this. If you're standing on a narrow beam, you'd be pretty wobbly, right?
You'd probably fall off.
Right, exactly. So if you widen your stance about 12 inches apart, you instantly become more stable.
Right.
It's the same principle for CNAs.
Oh, okay.
That wide base gives them the stability they need to safely lift and move patients.
So it's not just about being really strong.
No.
It's also about...
It's about strategic positioning.
Yeah, how you're actually positioning your body.
Exactly.
Okay, that makes sense.
And then there's the golden rule of lifting. Engage those leg muscles.
Okay.
Remember that analogy we always use about lifting a heavy box?
Right.
You wouldn't bend over at the waist.
And hurt your back.
Exactly.
Yeah.
It hurt your back. So CNAs are trained to use the power of their legs.
Okay.
Keeping their back straight and protected.
So using those big muscle groups instead of the little tiny back muscles.
Yeah, you want to protect that spine.
Right. But it's not just about the CNA's safety, right? It's got to be about the patient's comfort, too.
Absolutely. Comfort and safety, they go hand in hand.
Okay.
Think about it. If a patient is feeling anxious or unsure about what's happening, they might tense up, they might make sudden movements.
Right, and then somebody gets hurt.
Exactly.
Yeah.
Increases the risk of injury for both of them.
So it's almost like a dance where both partners have to be in sync.
Exactly.
So how do CNAs create that sense of ease for the patient?
It starts with simple things.
Okay.
Like explaining what they're about to do, providing privacy, using pillows for support.
Oh.
These small gestures can make a huge difference.
Okay, so it's about setting the stage for a positive experience. Yeah, but what about the actual safety measures?
Yeah.
What are some things that CNAs are trained to do?
So before even attempting to lift a patient, they carefully assess the situation.
Okay.
How much does the patient weigh? Can they assist at all?
Okay.
What equipment might be needed?
Yeah.
And they never hesitate to ask for help if they need it.
Right.
Two heads are better than one.
Yeah.
And it's better to be safe than sorry.
Right. So physically, what are they doing to make sure that the patient's safe?
They are avoiding any movements that could put the patient at risk. For instance, they're taught to avoid dragging or pulling a patient.
Okay.
Because that can cause skin tears or other injuries.
Got it.
So every motion is deliberate and purposeful.
Okay, yeah. So it's not just I'm just gonna
yank him up.
Yank him over here.
Right, exactly.
Every motion
has a reason.
Thought out, yeah.
Yeah.
Okay, so speaking of purpose, let's go back to some of those patient positions. We were talking about you got your supine, your lateral, your Fowlers, your Sims.
Mm-hmm.
Each one has a specific...
Each one serves a function.
Okay.
Yeah.
So supine... I'm guessing that's the most straightforward, just laying flat on your back?
Pretty much, yeah.
Okay.
But even then, there are nuances to it.
Right.
CNAs might use pillows to support the patient's head, knees, arms, make sure their body's properly aligned.
Gotcha.
Prevent pressure sores.
So it's not just about, like, plopping them down on the bed. It's like...
It's about creating a comfortable and supportive environment.
Yeah, that makes sense. Okay, and then lateral.
Lateral is just lying on your side.
Okay.
Like, think about you're just snuggled up on your side, maybe reading a book or something.
Gotcha.
That's the basic idea. But again, there's more to it.
Okay.
CNAs will use pillows to support the patient's back and limbs, making sure their spine stays straight, their body's properly aligned, and they'll regularly turn the patient from side to side to prevent pressure sores.
Okay, so there's thought that goes into even these, like, kind of basic positions?
Absolutely.
Okay, what about something like Fowler's?
So Fowler's is kind of interesting. Imagine a patient sitting up in bed.
Okay.
Their upper body's elevated at an angle.
Right.
So, like, they're propped up on a bunch of pillows.
Okay.
This is a really important position for patients that have difficulty breathing.
Wow, so just changing how they're positioned can actually help them breathe better.
Exactly.
That's amazing.
It's pretty cool.
Okay, and then what about Sims?
So Sims is a little more unique.
Okay.
It's kind of a picture yourself lying on your left side with your right knee bent up towards your chest.
Right.
This is a position that's often used for enemas.
Okay.
Or rectal exams.
Less glamorous.
Yeah, not as glamorous.
But clearly each position has its own purpose.
Its own specific purpose.
Yeah, it's like a puzzle. And each piece has to...
It fit just right.
Fit just right.
Yeah.
To give effective and compassionate care.
Absolutely. And we haven't even gotten to transfer techniques yet.
You're right. We've covered a lot of ground already.
We have.
But I'm excited to actually get into, like, the moving from bed to chair, helping people walk, all that stuff.
All right, well, get ready because that's where things get really interesting.
Okay, let's do it. Okay, so you mentioned transfer techniques earlier.
Yeah.
What are some, like, common scenarios a CNA might encounter?
Well, one of the most frequent ones is moving a patient from bed to chair.
Okay.
It sounds simple enough, but there's really an art to it.
Yeah. I can imagine.
Making sure the patient is comfortable and safe throughout the process.
So what are some of the key steps involved in that?
Well, first and foremost, communication is key.
Okay.
So the CNA would explain to the patient what's about to happen, making sure they understand the process, feel comfortable with it.
Right, so there are no surprises.
Right, exactly.
Nobody's getting yanked around.
Exactly. And then they would position the chair close to the bed.
Okay.
Lock the brakes. Swing away the footrests, make sure there's a clear path.
So setting the stage for a smooth transition.
Exactly.
Okay.
Next, they would help the patient sit up on the edge of the bed, give them a moment to adjust to that upright position, making sure they don't feel dizzy or lightheaded.
Okay.
We call this dangling.
Dangling, okay.
Yeah, and then they would apply a gait belt.
Oh, yeah. That's that sturdy belt that goes around the patient's waist.
That's right. It provides a secure handle for the CNA to assist the patient.
Right.
But it also gives the patient a sense of support, too.
Right. So they know
what to grab onto.
Exactly, yeah.
Okay.
From there, the CNA would help the patient stand up using their own legs for strength, keeping their back straight.
So again, all those
principles we talked about.
Body mechanics things.
Yeah, actually. Pivot towards the chair and then gently lower the patient down onto the chair. Okay.
Again, using those leg muscles for control.
It's like a carefully choreographed dance.
I love that analogy. It really is.
Well, like with way higher stakes.
Right, exactly.
Okay, and then I'm assuming they would reverse the process to get them back in bed.
Exactly.
But it's not always as straightforward as bed to chair, right?
Right.
What about the situations where a patient needs help walking?
Yeah, you're talking about ambulation.
Ambulation, right?
Yes.
And that presents its own
challenges.
Challenges, yeah.
For sure.
I'm particularly curious about fall prevention.
Yeah.
Because I feel like even with all the best techniques and everything, accidents can happen.
Absolutely. And that's why fall prevention is such a crucial part of CNA training.
Okay.
They learn to be hyper-aware of their surroundings, to anticipate potential hazards, to react quickly and safely if a patient does start to fall.
So it's not just about knowing the steps, it's also about being able to, like, adapt.
Definitely. Thinking on your feet.
Yeah. Think on your feet. Okay.
Yeah. So if a patient starts to lose their balance, the CNA would guide them to the floor.
Okay.
using their own body to kind of cushion the fall,
Wow.
protecting the patient's head.
So that sounds really challenging.
It can be.
Physically and emotionally, I would imagine.
It is, but CNAs are trained to stay calm and focused,
Right.
even under pressure.
Because their actions can make all the difference.
Exactly.
Yeah.
Between a minor incident
Right.
and a serious injury.
Wow. So it's a huge
Right,
responsibility.
It really is.
Okay, so we've talked a lot about the manual transfers, but I know that there's also all these incredible assistive devices that are available these days
Absolutely.
to help both CNAs and patients.
Absolutely, yeah.
So I remember the curriculum mentioned slide boards, trapeze bars, even mechanical lifts.
Yep.
So I'm curious how those are actually used.
So a slide board is basically like a little bridge
Okay.
between the bed and the chair. It reduces friction, makes it much easier to move a patient who might not be able to stand on their own.
So it's like a magic carpet ride,
I like that, yeah.
but for healthcare.
Exactly.
Okay, and then what about a trapeze bar?
So that's a metal bar that hangs above the bed, allows patients to use their upper body strength
Okay.
to help reposition themselves, get in and out of bed.
So it gives them a little bit of that
Exactly.
agency and independence.
Exactly.
Okay.
And then for patients who need more assistance, you've got mechanical lifts.
Okay.
So these use a sling to gently lift and transfer patients, minimizing strain on both the patient and the caregiver.
So technology is really changing
It is.
how we approach
It really is.
patient care.
Absolutely.
But I'm guessing even with all these devices, the core principles of body mechanics still apply.
Absolutely. Whether it's a simple transfer using a gait belt or a more complex move with a mechanical lift.
It all comes back to understanding
Those fundamentals.
leverage, using your legs, protecting your back. Okay, cool. And before we move on, I know you mentioned a technique earlier called log rolling.
Yes.
That sounds very intriguing. What is that exactly?
So that's a specialized technique used to move patients who need their spine kept perfectly straight.
Okay.
So like someone with a spinal injury or who's had back surgery,
Okay.
it's a very specific maneuver. Involves at least two caregivers working in perfect sync.
Okay.
So you're basically, imagine rolling a log.
Right.
That's kind of the idea.
Keeping that spine straight.
Exactly. So the patient's body is moved as one unit, no twisting or bending of the spine.
Wow. So that sounds like a lot of
teamwork. It takes a lot of practice, a lot of communication.
Yeah.
Each caregiver needs to know exactly what the other one's doing
right to make sure that they're.
To ensure a smooth, safe transfer.
Yeah. Wow.
It's an intricate dance, but with much higher stakes.
Absolutely. So we've talked about transfers, ambulation, assistive devices, even log rolling.
Yeah.
Is there anything else that kind of falls under this umbrella of body mechanics for CNAs?
Well, we've focused a lot on the physical techniques.
Yeah.
But there's another element that I think often gets overlooked, communication.
Oh, that's right. You mentioned that at the beginning.
I did, yeah.
But I'm curious to hear more about how communication actually plays into all this.
So think about it. If a CNA is about to lift a patient, but the patient isn't ready or isn't sure what's happening,
Right.
that can lead to resistance, tension, even injury.
Right. So it's about more than just the physical movement.
It is. It's about clear communication.
Got it.
CNAs are trained to explain each step of the process to the patient,
Okay.
to ask for their input, to check in regularly, make sure they're comfortable,
So it's like
and that they're not experiencing any pain.
it's like a partnership between the CNA
Absolutely.
and the patient.
It really is.
Yeah, it's not just
Yeah, it's not just a one-sided thing.
one person doing something to the other person.
Right. It's a team effort.
Okay, cool.
So that partnership is built on trust, respect, clear communication.
So it really brings in like a whole nother dimension to
Yeah.
this concept of body mechanics.
Absolutely.
Yeah, it's not just moving bodies, it's about connecting with people.
Absolutely. It is. And that's what makes the work of a CNA so special.
Yeah.
It's that blend of physical skill, technical knowledge, and genuine compassion.
And I feel like that communication piece is really
Yeah.
where that compassion comes in.
Absolutely.
Yeah. So it's really clear that body mechanics is so much more than just like
Right.
a set of techniques.
Yeah.
It's really like a whole
A philosophy of care.
philosophy of care.
Yeah. Permeates everything they do.
That makes sense. And you know, it's interesting because you were talking earlier about the bigger picture. And I'm wondering, how does body mechanics fit into that bigger picture of, you know, the healthcare system as a whole?
Well, I'm glad you brought that up because it's a fascinating connection, one that I think is often overlooked.
All right, let's dive in. Okay, so we've really gotten into the nuts and bolts of body mechanics for CNAs.
We have.
The techniques, the reasoning behind it.
The why.
The why, the importance of communication.
Absolutely.
But I really like this idea of zooming out to the bigger picture.
Yeah.
So what is that connection between body mechanics and like the overall health of the entire healthcare system?
It's fascinating.
Okay.
And, like we said, often overlooked.
Right.
Think of it this way.
Okay.
Every time a CNA safely lifts a patient,
Okay.
every time they prevent a fall,
Uh-huh.
every time they use proper body mechanics to protect their own back,
Yeah.
they're not just performing a task, they're contributing to this, ripple effect.
Okay, so break down this ripple effect.
Okay, cool.
What are we talking about here?
Let's start with the most obvious, preventing injuries.
Okay.
If a CNA hurts their back because of improper lifting,
Yeah.
that's not just a personal setback.
Right.
It's a loss for the whole system.
Right. Right. They're out of work.
Exactly. They're out of work, potentially for a long time.
Which means more work for other people.
Exactly. Puts a strain on staffing levels.
Right. Yeah.
Increases the workload for their colleagues.
Yeah. So it's like this domino effect where one injury
It is.
can lead to other injuries.
Absolutely.
Burnout, compromised patient care.
Exactly, because you have fewer people doing more work.
Right. And then on the patient side,
Yeah.
if a patient gets injured during a transfer, I
Yeah.
mean, that could lead to
Longer hospital stays.
longer hospital stays.
Additional treatments.
More complications.
Exactly.
Wow. So it really is a costly
It is.
situation all around.
Both in terms of, human suffering and financial resources.
Right. So it's not just
It's
about
not just about the individual.
being nice to the CNAs.
Right.
It's like, this is good for the whole
It's good for everybody.
system.
It makes the whole system run more smoothly.
Yeah, and it's cheaper.
Exactly.
And it's more efficient.
more efficient, yeah.
I'm starting to really see how something that seems
Oh.
like so simple
Basic.
can have such huge
Yeah,
implications.
absolutely. It's like this, I don't know, like a small gear that keeps a whole machine running smoothly.
Right. Okay.
You know what I mean?
I like that analogy. And it makes me wonder, like,
Yeah.
given what we've learned, how could we design like
Oh, that's
the
interesting.
healthcare spaces to better support these principles?
That's a great question.
Because I'm thinking like adjustable beds
Yes.
that raise and lower easily, wider doorways
Yeah.
to fit wheelchairs and lifts,
Mhm.
rooms with more space to maneuver.
Yeah, you need room to work.
Yeah.
And the right kind of flooring, too. Something with good grip.
Right. So nobody's slipping and sliding around.
Exactly.
Oh, and grab bars.
Oh, yeah. Grab bars are essential.
Strategically placed.
Yeah, and make sure they're, sturdy.
Right. It's not just about like looking nice.
No.
It's got to be about function.
It's about functionality, safety.
Yeah, and lighting.
Oh, yeah, good lighting.
So there's no shadows and people can see what they're doing.
Absolutely. Make it easy to see potential hazards.
It makes me realize that designing a hospital or a clinic or whatever, it's not just about aesthetics.
No.
It's about really creating a space
It's about creating an environment
that works.
that supports the well-being of everybody,
Yeah.
both the caregivers and the patients.
And it goes beyond just hospitals and clinics.
It does, yeah.
I'm thinking nursing homes, assisted living.
Private homes, yeah.
Yeah, anywhere that people
Anywhere where care is being provided,
need help.
you can apply these principles.
Yeah, it's really about making the built environment work for us.
It is. It's a challenge,
Yeah.
but it's also an opportunity.
Yeah, to make these spaces that really,
Support healing.
that really nurture healing and well-being.
Absolutely.
Wow. Well, I think that brings us to the end of our
I think so.
deep dive.
Yeah.
We've covered a lot of ground. We started with some basic terms and techniques.
Yeah, we did.
And we ended up talking about like the entire healthcare system,
How it all connects.
how it all connects.
It's all intertwined.
Yeah. So to our listeners, as you move through your day, whether you're at work, at home, out in the world,
Yeah.
think about those spaces around you.
Yeah.
How could they be better?
How could they be designed
How could they better support
to support safe movement?
safe movement and prevent injuries?
It's something we can all think about.
It's a challenge,
Yeah.
but the rewards
The rewards are worth it.
are worth it.
Absolutely.
Well, thanks for joining us on this deep dive.
It's been a pleasure.
Until next time, happy diving.